how are you doing?
Good.
My name's Caitlin Getchell. I'm a student physical therapist at the University of St. Augustine. How are you today?
Good.
So can you please confirm with me your full name as well as your date of birth?
Ian Hammond, December 7th, 1990.
And do you mind if I check on your wristband?
Yeah.
Awesome. So I understand that you've come here today after having a little accident a couple days ago. Can you tell me a little bit what happened?
Well, I tried to do a trick I thought I could do and not being able to, and I wrecked pretty gnarly on that
And
board.
so you're having some pain here in your shoulder?
Yeah.
Is it kind of in that front area?
Right.
Okay, so today I think a good thing that we can do is ultrasound. So what the ultrasound does, it has this effect where it can help decrease your pain, and the way it does that is by increasing your pain threshold. And then another thing it does is improve your healing, and it does this by increasing the cell permeability. So all of that's going to kind of help improve the injury you're having. So does that sound like something you're interested in?
Yeah, definitely.
Great, so before we begin that, we do need to check some things that are called contraindications, and if you have any of these, then we can't do the ultrasound.
Okay.
So, are you aware of having any DVTs or deep vein thrombosis?
No.
How about hemorrhagic conditions?
Nope.
And then lastly, impaired circulation?
No.
And then there's some precautions, which if you have these, we can still do the treatment, but we just want to be extra cautious about it.
Okay.
So do you have any plastic or cemented implants?
Nope.
We're not doing it over your spinal cord, so we don't have to worry about that. And then, do you have any known infection right now?
No.
Okay. So if that sounds good with you, we could do the ultrasound treatment.
Yeah, definitely.
So if you could you take your shirt off for me? Okay, so before we begin, I'm going to just do a general skin inspection. So I'm just going to be looking around to make sure you don't have any open wounds or rashes or anything, which looks good to me.
Okay.
And then I'm also going to go ahead and palpate the area, so I'm just going to apply some pressure, and you can tell me where you feel like the most tenderness.
Probably about right there.
Probably right here in the front. Okay, so on a scale of 0 to 10, so 10 is going to be pain so bad you have to go to the emergency room, and 0 being no pain at all, where do you fall in that scale right now?
Probably like a 6.
Probably about a 6?
Yeah.
All right, great. So the next thing we're going to do is what we call a sensation test. So we're going to do this before the treatment as well as after, just to make sure you don't have any adverse reactions, which you shouldn't. But I'm going to go ahead and rub this cotton ball on your face, and it's going to feel just like this. Feel it?
Yep.
So now I'm going to have you close your eyes. I'm going to swipe it on your shoulder, and every time you feel it, I want you to say yes.
Okay. Yes. 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 Yes.
Perfect. You can open your eyes. So your sensation's all intact, so that's really good. So the next thing I'm going to do is I have the ultrasound machine set up with the correct parameters. So for the frequency, we're going to do 3 megahertz, which is for superficial tissues, which is what we're trying to target.
Okay.
The intensity set at 1.3 watts per centimeter square. The BNR on the machine is 6, and then the ERA is 5, which means we can get about a total of 20 centimeters square for treatment area.
Okay.
Okay? So what I'm going to do is pull this a little closer, and I'm going to apply this this ultrasound gel. It's going to be a little cool, but it's going to stay as a medium to help this glide a little bit easier, and so we don't mess up the machine.
Okay.
Okay. So I'm going to apply it first before beginning the machine, and it might be a little cool, so I apologize about that. Okay, so now I'm going to go ahead and start it. We're going to do this for about 5 to 10 minutes.
Okay.
Okay. And we're just going to go in small little circles here. How's this feeling?
Good.
If it does start to feel a little bit weird, just go ahead and let me know.
Okay.
I also have this on a duty cycle. It's called intermittent or pulse, and this is going to create a non-thermal effect because we don't want to irritate the tissues anymore, so that's why you might feel this. All right, so that's been about 5 minutes, so we're going to go ahead and stop this. We're going to remove it, wipe off the extra, and I'm going to go ahead and wipe off the extra gel on your skin. Okay, so now we're going to go ahead and skin inspect again. And it's a little bit red, but that's a little bit normal. That's an appropriate response. Everything else looks great. Now I'm going to go ahead and we're going to recheck that sensation. Do you remember what it feels like?
Yeah.
So I'm going to have you close your eyes again
Okay.
and tell me yes when you feel it.
Yes. yes, 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 yes.
Perfect. Go ahead, open your eyes. And the last thing we want to do is on that same 0 to 10 pain scale, where are you falling? Like, what are you feeling right now?
Probably a 1.
1, so we got a decrease in pain, which is great. Other interventions we can do are active range of motion, which is just like shoulder flexion, and we do 50% 1 rep max in a pain-free range, and that's going to also help improve your injury.
Awesome.